4-tad gummy smile correction. Let's go. All right, Alaya came in with the chief concern of her gummy smile. That was it. A little bit of spacing between the teeth, but that really wasn't her main issue. It was that she just didn't like the fact that when she smiled, she saw so much pink and not enough white. She had saw some things on our social media about us doing it and really wanted this treatment. And if you make it to the end, there's a really fun surprise that I think makes this case absolutely worth sticking around for the next 8 minutes and looking. Again, she came in at 14, took us only 16 months to treat the case. And I really want to get into it. What's really fun about this is very much the normal protocol that we treat our gummy smile cases with. In the previous case, we showed one that had a lot of complexity and she was also a team member. So we went a little bit different on that one. But let's look at this. You can see that she presents like most gummy smile cases do. Class 1, nice alignment, decent arch width, and maybe a little bit of spacing or a little bit of crowding. One thing also to note is that patients usually have a very, very excessive amount of keratinized tissue. So the mucogingival line is usually pretty high. This makes the case actually easier to treat because it gives us a lot more room to place the TADs. So when we look at this, again, nothing that was out of the ordinary, just class 1, some protruded and proclined incisors, which we're going to address with braces, arch development, and the Damon Ultima system. But the main factor is to intrude this maxillary dental arch so that we can really make this gummy smile go away. If you look at the x-rays, it's pretty much not contributory. And you can see from beginning to end, we're able to satisfy her concerns. Her gummy smile was beautifully treated. The teeth were beautifully set using the Damon Ultima system and just really, really good bracket positioning, very clean mechanics, which we'll get into. And this whole thing took about 16 months. So she comes in, we all know that phase 1 is all about direction and foundation. We want to make sure that we get things set. So we're going to go through our arch wires, 014, 018, 14, 0275, and then we're going to go ahead and place our TADs pretty much in the middle of phase 1. So we start with the day of bonding. You can see here now that we're going to go through our lift protocol. Our lift protocol is really quite simple. We're going to be placing 2 8mm vector TADs at the mucogingival line between the maxillary second bicuspid and the maxillary first molar. Then we're going to use 2 more TADs between the canine and the lateral on the right and left side, just below the mucogingival line. Now, people always ask if I have to diverge these roots, and the answer is no, I never do, because most patients that have a significant gummy smile have a lot of maxillary excess. So these teeth have grown down, and what's neat about that is the mucogingival line stays where it was originally kind of found. So you get a long span of keratinized tissue, which means the higher you place the TAD, the more room you have between the roots. And honestly, with a 6mm vector TAD, we really don't have any issues with that at all. Now, the neat part about this compared to our lift protocol for vertical control is that I don't need to place palatal TADs in most of these cases. What we do is we put a flat plane occlusal block on the lower first molars, and then we use some articulating paper to make sure that the palatal cusp has a point to flat plane contact. Now, we want to make sure that it's a point to flat plane contact that's even so that when the patient bites down, and the studies show that we chew about 3,000 times a day, that you're applying 60 to 80 grams of force on that palatal cusp. As long as you're tying the buccal TADs with a very light force, this seems to be enough force to prevent tipping and causing a rotation with palatal dropping. And again, this is where it's very important to show restraint. When you're intruding teeth, it's 20 grams of force is really all you need. So when we're looking at the force vectors and we're using 4 TADs, really we only want about 60 grams of force as we apply to each TAD around the wire. That's 1 link of active C-chain generation 2. So we basically cut it, connect it to the TAD, wrap it around the wire, and then we activate it 1 link, tie the TAD, and we do that every 6 weeks. This is what it looks like from the buccal and the front. So you can see that it's very clean, very easy, very simple. I do recommend this is a great way to start TADs and vertical control because it's some of the easiest stuff you can do, and it's some of the most visually dramatic. So if we look at Alaya, you can see this is what it looks like at 6 months. She's got her TADs in. We're just tying these every 6 weeks when she comes in, and it's going really well. Now you can see that we're starting to get a little bit of an open bite, which is expected because we're intruding. Once we get to phase 2, we're going to put our 180275s in. This is where the Damon system really kind of helps us out because with a full expression system, as we've gone through in other cases, the 18 by 0275 gives us a first, second, and third order full rotation couple so that we can really control these teeth. And it really just allows us to position them where we want them. Meanwhile, we're tying the TADs as needed to get rid of the gummy smile. So here she is at 9 months. I felt that I've already intruded her upper teeth, probably more than I wanted. So I tied those off with some stainless steel ligature ties, and then we started her vertical elastics, which is a 3-3-4 protocol. Now, if you do intrude a little too much, all you have to do when you're running the rubber bands is just give one visit where you don't tie the TAD, and it'll kind of erupt a little bit. Again, sometimes these things intrude more than you want, and when you look at taking in account trimming about 1.5 millimeters of gingival tissue, the first couple cases you do, you might over intrude a little bit. So just let those go and they'll come back down a little bit. So here she is in the beginning of phase 3. You can see now that we're going to go ahead and remove the TADs and give her a laser treatment. She's looking really good. Here's 1 week before removal. We have her at 16 months. We're able to take the braces off and get this young lady finished quite quickly. So again, we took the TADs out pretty much right after phase 3 started. Took a laser, trimmed the upper 4 to 4 so that we could have a really nice set, finished her up some elastics, and here she is. So good occlusion, great smile, good gingival architecture, great tooth position. She's a really, really, really beautiful case, treated all around. So again, you can see how impactful this is and how easy it is, really. You're doing the exact same thing you would do if you were not treating the gummy smile. The only difference is you're adding 4 TADs, and every time you come in, you're treating 2 separate things. The vertical control of tying the TADs, and then the tooth control of changing your arch wires. And we do them concurrently, so we're not waiting for one or waiting for the other. They happen on the same timeline. So theoretically, and I've shown videos before where it takes me about 5 or 6 minutes to place the TADs. Each appointment, it takes maybe another 5 minutes to tie the TADs. So you're adding very little time to get such amazing outcome in a case like this. So here she is, final records. X-rays look great, and she just looks absolutely stunning. Her mini aesthetics look good. Her micro aesthetics look good. And again, overall, an absolutely wonderfully treated case. Now, I said there was a little surprise at the end of this, and here it is. Alaya was a twin. She came in with her sister, Alexis, and her Alexis had the exact same problem. So it was fun because they always dressed together, and we were able to take pictures. So here's a few of them. Every time they come in, I would take a picture with them because they were like, when I was a kid, there were these things called the Doublemint twins, and they were just adorable. They would wear the same clothes to their appointments. They were always happy, always smiling. And, there were a few differences in their case, but at the end of the day, we treated them both on the same timeline for Gummy Smile. And it was just an absolute honor and a joy to treat these young ladies. So if this is something that you find interesting, please, check out our socials, look at our YouTube. We're posting a lot of these cases in full format on YouTube so that it gives you a good idea. And more importantly, share the word, send it to your friends. There's going to be some great educational content that we're posting, and I'm just here to try to help people learn how to do this stuff the way that other people have taught me. So hopefully you enjoyed this and have a great day. Bye-bye.